Okay, let's go ahead and get started, everyone. Thank you so much for joining me. My name is Laura Winnie, and I'm the Education and Community Engagement Coordinator for DuPage County Animal Services. Tonight, we are going to talk all about senior pet care. So we're going to discuss what is a senior, what does that mean, keeping your senior healthy, and then some common issues and signs to look for with our senior friends. Before we get super into it, though, just a little bit of Zoom housekeeping. Everybody is muted. We are recording this to put on our YouTube page later, so everyone's muted to prevent any audio interference with the recording. If you have any questions, feel free to throw them into the chat box. The presentation should take about an hour, and I will stick around at the end for questions. Feel free to throw them into the chat at any time, but I will not check the chat until the end of the presentation. Just to show you what that looks like, I have thrown our survey link in there. We are always looking for feedback, ideas for future programs, and how we can improve. So hopefully I'll remember to remind you at the end of the program, but please do take that very short survey to give us some feedback. And without further ado, let's go ahead and get started. So when we talk about a senior pet, a lot of us typically have an idea of what that looks like. Okay, it's the frosty face, it's the hunkered down, get off my lawn attitude that you might see in some of our seniors, but not always. And sometimes pinpointing a specific age can be a little hard because it does vary due to species, even the breeds within species, their life conditions, then even the early nutrition can affect what we consider a senior later on, their genetics and their socialization. So studies have shown that bonded rabbits tend to live longer, and older dogs typically do respond positively to an additional dog in the household. Okay, so socialization can be a big factor, and we'll talk a little bit more about this here in a minute. So let's take a look at this chart, what we consider in general, what we consider a senior. So for cats, mature adults, anything above the age of 8 is going to be considered a mature adult. Some vets tend to lump together that mature adult and that senior right together. So they may start calling your 9 or 10-year-old cat a senior, which is fine. Sometimes it just depends on individual veterinarians, how they break it down. So generally, cats tend to have the longer lifespan, so they're going to be seniors a little bit later in life. Small to medium dogs might be considered seniors once they hit 8 or 9. Large to giant breed dogs, though, since they do typically have that shorter lifespan, as early as 6 years old, can be considered a senior. Rabbits also are going to be dependent on breed. Specifically the size with their breeds. So small breed rabbits, they're going to be more considered a senior at 8 years old. Think of the Netherland dwarf, the Polish. Those are often the longer lived breeds. Medium breeds in the middle, sometimes are mixes, might be considered a senior more at 6. Their lifespan's a little bit shorter. And those large breeds, so the Belgian hare, the French lap, the Flemish giant, those big ones, they do have the shortest life expectancy, 4 to 7 years. So they are considered a senior at 4. Now, as I mentioned, there are all sorts of different signs for a senior. So some of the typical ones that we think of pretty much mirror our own as human animals, what we're looking at. So a little bit of stiffness, difficulty moving around, hearing loss, vision loss, and those cloudy eyes, dental disease, and just horrific breath can be a big one. Weight changes, behavior changes, increased drinking, even changes in how much they eat. Also, elimination changes, not just are they having accidents in the house, but the frequency that they're going and how much they're producing during elimination. They might start having difficulty grooming. A lot of times that can be related to stiffness, difficulty moving around. And for our rabbits, looking at those hocks and looking at those calluses, that can be a sign of seniors. And I would put in here as well, along with behavior changes, just changes in adaptability. As we get older, we're a little bit more set in our ways, and this is true for our pets as well. So when I mentioned before that socialization can be a factor in how long our pets live, I would caution you against inflicting a puppy on a senior dog, because that right there is just going to bring out the get off my lawn mentality. Some seniors perfectly fine. They, love a challenge and they love teaching other animals. That's great. But when you are considering a companion pet for your senior pet, you really want to think about what their energy level is, and trying to match it is always recommended, as opposed to trying to get them out of their comfort zone, because trying to match energy levels is going to make them more comfortable and more receptive to any new additions. There are tons of benefits of having senior pets in the home. So absolutely, if you are considering adopting a senior pet, way to go. They can be one of the most rewarding animals to bring into your home, because typically they're a lot less work. Let's face it, puppies, kittens are adorable, but they are a time suck. They take a lot of work and a lot of focus and a lot of your energy. Senior pets, they've been there, done that. Typically, they're housebroken. I've already got that part down. They don't require as much training. They're going to be calmer. They're not going to be running around at 3 o'clock in the morning all crazy. They're already full grown. And this is important if you have any weight limits. Let's say you're renting in an apartment and you are concerned about making sure you stay within the weight limits that your lease requires. If you get a puppy or a kitten, sometimes it's a crapshoot of how big they're going to get. Because I will tell you right now, looking at a puppy and making your best guess on what kind of dog it is no guarantee that you're anywhere close. We at DuPage County Animal Services, we've gone away from even trying to guess breeds a lot of the times, because how they look doesn't always match what they are genetically, which means how big they can get. So that's very, very important. Personalities are typically set as well, so no surprises. If you're looking for a snuggly lap cat or a couch potato dog that's gonna Netflix with you, seniors are a way to go, because you'll already know, yeah, this one loves to cuddle. As opposed to if you are looking for an animal that is going to be raring to go, a little bit higher energy, believe it or not, senior pets are still a good way to go, because we have had tons of seniors that still have a lot of life left in them, and by no means are all seniors couch potatoes, okay? It can also be a little bit easier on first-time pet owners to bring home a senior pet, again, because it's a lot less work that first go around. And also, when I brought a senior pet home, I don't know if it was my imagination, but she seemed a little bit more forgiving of me as a first-time pet owner when I screwed up, she would just, sigh and look at me, like the old church ladies, and she'd be like, oh, you sweet thing. No, this is how you do it. So there's a lot more leeway room there with working with a senior pet, because they've been through some stuff typically to wind up as an adoptable animal as a senior. And they're just in so much. They're so grateful. They're so happy to be back in a home. And you will see seniors in shelters for a lot of the same reasons that younger pets come into the shelters. You know, senior pets can still go on an adventure and get lost. Senior pets can still have some need for additional support that maybe their home life doesn't support. You might have a family member that moves in and then needs, they have allergies or something like that. So the senior pet can no longer stay in that home. Or their companion has moved on to a place where they can no longer keep pets. So we do see that quite a bit when we get some older pets in because their older person, unfortunately, can no longer care for them. And also, you might see some seniors because the family has done the thing where they brought home a brand new youngster and that was just not a good fit. And so the family decides, okay, well, we've already got the youngster, so unfortunately, we're going to have to say goodbye to the senior. So unfortunately, that does happen from time to time. And a lot of that is through no fault of the senior. Like, they are fine, and the change in their life was not their fault where they wound up. So highly advocate for bringing home a senior pet because they are just so sweet and so grateful. And you are truly, truly saving a life when you bring home a senior pet there. Now, let's say you have a senior pet that has been with you through the years and they are getting up into their retirement age, or you've just brought a senior pet home and you're wondering, okay, how do I make our time together last as long as possible? How can I make sure that my senior is going to stay as healthy as possible? Well, there are lots of things that we can do to monitor our pets for special needs. And then that way we can address those special needs at the early onset. Because just like with us, detecting stuff early is going to give us more options for treatment and more chances at a positive outcome. So they will definitely need more attention. Discuss with your vet what to monitor. Some breeds are prone to specific genetic conditions, for example, retrievers and labs, hip dysplasia, PITS, ACL, certain breeds of cats may be more prone to diabetes, and you'll want to increase your vet visits. So instead of that annual wellness check, at this point, it's important to get more eyes on your pet, right? So bringing your pet in maybe twice a year, so every 6 months, and starting to do that senior blood panel, because our animals are so good at hiding things, physical things from us. I mean, it's from their instincts of survival in the wild, right? You hide your weaknesses so nobody can take advantage of them. And they still do that in our homes. So you may not even notice things going on that your vet will pick up on or that senior blood panel may pick up on. They may need help with grooming. We talked earlier, some stiffness may make it harder for them, or they may need additional support in other areas. If you haven't, I would consider spaying or neutering any of your pets, especially as they reach older age. They are more prone to reproductive illnesses, reproductive cancers. Female dogs are prone to an infection of the uterus that can be fatal. So definitely spaying and neutering cuts all those out. They're gone. Those risks are taken care of. So definitely talk to your vet about that if you haven't spayed or neutered your animal yet. You might want to also consider changes in diet, not only what they're eating, but also how much. If they are moving less, they are less active, then they may need a smaller portion than what they had before. I mean, if you have a senior cattle dog and you've gone down from your 4-mile walk every day to a 2-mile walk every day, going to need to cut back on the kibble just a little bit. Other instances, some diseases may require more food to help maintain body weight as their metabolism changes. Different ingredients in the senior dog food might be recommended, but be cautious because there's no regulation on what is in senior dog food or senior cat food. It's a marketing technique, okay? So you really want to talk to your vet about the options out there and specifically which supplements and which nutrients will be beneficial, because you don't want to put in unnecessary stuff. You don't want to pay for unnecessary stuff that is just a marketing gimmick, okay? So talk to your vet about supplements. Things for coat health, joint health can be very, very beneficial for our seniors. We also want to take a look at what we are expecting from our seniors and understanding that the aging process isn't fun, but that doesn't mean that all fun is gone, okay? It just means that life has changed. It's in a new stage, and we want to make sure that we are respecting the changes that they are going through with this new phase of their life. So modifying what we expect from their physical activity, all right? I hear it a lot. You know, my cat hates playing. I have a senior cat. She hates playing. Well, a senior cat isn't going to play the same way that a kitten is. And we'll talk more about this on the slide. So we need to change how we're offering play to make sure that our cats, our dogs are still getting that exercise, but just in a modified way. Socialization is going to be a big one too, again, with the puppies and with the kittens. Your seniors may not appreciate that. Your seniors may also not appreciate going to a dog park anymore. It may have been something that they loved when they were younger, but it may just be too much of a stressful environment. That is something that you need to pay attention to with your individual animal, because 100% every animal is an individual. They all have their likes, dislikes, personalities, and everything. So when you are taking your animal someplace, pay attention to their body language. Are they excited to go there? Are they fighting you? When they get there, what do they do? Are they engaged with what's going on? Are they hunkered down in the corner, freaking out? Are they staying by your side the entire time? So paying attention to, are they enjoying it? Are they engaging with the environment that you're offering or not? Might be a clue to you that it's time to seek out other ways of socialization. And adaptation to change is going to be another one that we want to modify our expectations, because all animals, human animals included, thrive on routine. We do really good with our routine. It makes our brains happy, okay? So knowing when we're going to get that breakfast, when we're going to get that lunch, when we're going to go for our walk, you know, when we're going to have snack, when is bedtime, when is playtime. Kittens and puppies, you know, younger animals, they're going to be more okay with changes to those routines. For example, I do outreach at the shelter, and I will often get people ask me like, oh, can you please bring an adult cat? And I say no, unless I have a unicorn adult cat who loves doing that kind of thing. I typically say no, because our adult cats are going to be more stressed out by changes to their routine than kittens who don't know any better. Okay, like kittens, as long as you have kibble and as long as you have some toys, they're good wherever. But the adult cats, they like what they like, and ripping them out of that environment just to take them to an event is going to be very, very stressful for them. So understanding that and doing what we can to alleviate stress when we have to make those changes. So understanding how can we make their trips to the vet easier? Maybe by offering their favorite treats, by making sure that their carrier smells comforting, whether we're using pheromones or blankets that they sleep on so they're surrounded by their smell. You know, that's going to help them deal with those stressful situations when they have to. We also want to take a look at the environment that they're in, because the last thing we want is for our animals to feel like their environment is hostile to them. Okay. So one of the things that we hear a lot at the shelter is, oh, my cat stopped using the litter box. I need to surrender. And then as we get to talking, we realize that, the litter box is in the basement down 2 flights of stairs from where they normally are. Okay. Have we tried moving the litter box? Maybe the stairs are uncomfortable now, or maybe they need to go more frequently and it's harder for them to get to the litter box in time. If you have a high-sided litter box, maybe your senior cat is struggling to get up and over. So you might want to use something like shown here in the picture with a low lip where they can easily walk in and out. They might also have difficulty with sudden temperature changes. So making sure that you're providing heated places for them. For example, splurging on an orthopedic dog bed or a heated dog bed can really help seniors that are suffering from arthritis and joint pain, and it can help them sleep better too. So a nice pain-free, restful sleep can really reduce their pain, improve their quality of life, and help with their mobility. So that might be something you want to consider. That access to basic needs. Where do we keep their food? Where do we keep their water? How do they get to their potty spot? Can we use ramps or stairs in place of high jumps or something like that to make it a little easier on them? Now, that being said, we're modifying the environment, but we're not just letting them laze about all day and just providing food directly to their face. As awesome as that sounds, physical exercise is still very important, because lack of exercise can lead to muscle mass loss, and it can it's a slippery slope. It can go downhill. Obesity is very, very dangerous in older pets. It's linked with a lot of different diseases and conditions that can be fatal. And it's also linked to their brain health. So physical exercise makes their brain happier as well, releases those endorphins, and it helps relieve stress. So very important. Certain veterinarians may specialize in geriatric medicine and might have recommendations for specific exercises. So for example, if you have a dog that's suffering from joint issues or hip dysplasia, they may have specific physical therapy routines that you want to go through. For example, my senior dog had weak hips due to joint degeneration, and our vet recommended walking along the side of a hill and then walking back, so that at each point her bottom legs were taking on more weight and therefore were needing to be a little bit stronger. And then when we go back, the same thing, instead of just walking on a flat surface. So things like that can be very helpful. And even just making small changes to your routine can help. Small changes. So for example, instead of just having kibble in a bowl, we spread it around a little bit, so they have to walk to get to it. Okay. Using kitty towers and ramps to have them move further to get to their food or to their treats. That's going to be helpful as well. Now, we want to definitely monitor to make sure that our pets are still getting the food they need, right? We don't want to put it up on the tower like, haha, you got to work for it. And that's just not something that they're capable of, okay? So you might want to start at a lower level, maybe move the bowl up higher over time. We don't want to do anything too sudden and too drastic. Give them a fighting chance. Because slowing down isn't necessarily natural. It can be a sign of a lot of different conditions: muscle pulls, arthritis, other pain. So it's not necessarily that, oh, well, dog doesn't want to walk anymore because it's getting old. Maybe the dog does want to walk, but physically can't anymore because of a medical condition going on. So definitely, if you notice that your pet is slowing down, that is something to bring up to your veterinarian so they can help rule out any underlying conditions that might cause that. Now, we talked about the importance of physical exercise, but definitely want to emphasize the importance of mental exercise. Because, I mean, think back when you were taking a really bad, really big test in school, how tired you were at the end of it can be just as satisfying working your brain as working your body. And this is especially important for the bad weather days or when our pets are recovering from illnesses and they can't move around as much. There are studies that show, just like with humans, working our brains prevents or slows mental decline and cognitive dysfunction. So that whole idea of use it or lose it kind of thing applies to our pets as well. It can also prevent boredom and curb destructive behaviors. So let's say, for example, that you have a very active animal that you normally go on jogs with in the morning. Well, they now have arthritis, so they can't do those jogs. So you go on the jog and leave your dog hanging out in the living room. You come back and I don't know how it happened, but your couch exploded while you were gone. You want to give them something else to do that works their brains. Training. Absolutely, old dogs can learn new tricks. So training is very important. We recommend doing just a couple minutes throughout the day. You don't want to do like a huge long training session that isn't fun for anybody, but a couple minutes, a couple times a day. Puzzle feeders. They have to use their brains to figure out how to get the reward of their food. Hide and seek games. So that can be with toys, with food, or with you. So you can work with a partner, have somebody let your animal in, and you're hiding somewhere. And then when they find you, they get lots of praise and a treat. Okay. Interactive toys are also a great way if you can't be right there hands-on doing things with them. Interactive toys can help fill that gap. Wonderful. Now, what do we want to look for with our seniors? Because there are definitely things that we want to be on the lookout for to get as early early intervention as soon as possible. Okay, so let's talk about some of the things that you might see in your senior animals. Big one, same thing for us, hearing and vision loss. This is more likely to show up as a changed behavior. And while it seems pretty scary for us, the idea of being, hard of hearing or, losing sight, animals rely primarily on their sense of smell. So it's amazing how well they can identify and navigate their environment without relying on their eyes or ears. So one thing to look for would be how they respond to stimuli. Okay, so they might be startled when you touch them or difficult to wake up. They didn't know you were coming. They're not reacting to sounds like they used to, like thunder, fireworks, things like that. They might be louder and they might be more vocal in their demands. It's the idea of my dad is ridiculously loud. And when he was 2 years old, they gave him a hearing test because they thought he was super loud because he was deaf. And nope, just super loud. But now that he's older, he's gotten louder. And yes, there is some hearing loss attached to that. So paying attention to their vocalizations is going to be key too. If they're not looking around their environment as much, so like if they're looking out the window, but they're not really reacting to something that they see, or if their ears aren't moving in response to noises, okay? Even just sitting still, if there's something that you can't hear, a lot of times they'll be able to hear it when they're in their tip-top health condition. So if their ears are, just hanging out, might mean that their hearing is now more on par with yours, which means it has declined. If they don't recognize you from a distance anymore, so if you are coming home and you cross the yard and they respond angrily to you because they think a stranger has come in, that might be an indicator. Maybe they're having issues catching or playing with some of their toys. You might also notice visual changes to their physical eyeballs, so they might get that cloudiness that you see sometimes. Now, this is going to be a common refrain throughout our common issue slides. What you can do is consult with your veterinarian, okay? No amount of Googling is going to replace the expertise of a veterinarian who can physically look at the animal, do tests, talk to you about behavior. So 100%, if you suspect something's going on, your vet's your first call, okay? It seems simple, but a lot of times we resist it. Sometimes it's cost prohibitive. Sometimes we think that we can manage things on their own. I like to just keep my vet in the loop. So I don't even necessarily go in. I'll just say, hey, I've noticed this. Do you think it's something that we should come in for? And let them decide. They might say, monitor it for a few weeks, see if it improves or changes, and then let me know. Okay, so not everything needs to be rushed to your vet, but definitely talk to them. Now, with hearing and vision loss, a lot of times we notice it when they stop responding to our cues, to our commands. So a way to prevent that difficulty in the future is by working with our animals now by combining visual and auditory cues. Okay, so for example, I will say sit, but I make a motion that means sit. That way my dog has two cues that they're relying on. And visual cues tend to be a little bit easier for dogs to learn anyway. Our go-to is vocal, but their go-to is sight-based. Doing that will make it easier if they do have deficiencies later on in life. They can fall back on using the other cue. You'll probably want to work on keeping the home layout the same or similar as possible, not changing things up, especially for those with vision impairments. A friend of mine in college had a blind cat, and you could not tell she was blind unless you moved a piece of furniture. Just that was it. Like, she navigated her world perfectly unless some idiot came in and moved a table. And then it was obvious. But we want to make sure that we're keeping everybody safe. So leaving stuff the same, or if you do need to change it, guiding your animal through those changes, letting them explore it and learn the new layout. Also providing extra safety cues. So maybe we're lighting up areas where they need to go. So we're lighting up their food bowl areas to make it easier for them to find. Or we're gating off doors, stairwells, so that they don't accidentally stumble on those areas. Also, we want to avoid startling animals, because startled animals do have a tendency to protect themselves. So we don't want to ever force our animal into a situation where they feel the need to defend themselves. So be super obvious when you're approaching them. If you do have an animal suffering from hearing or vision loss, stomp your feet as you walk into the room, if that's possible. Clap your hands, wave your arms, change the lights. Think about how you would wake up a toddler, or not a toddler, a teenager. Think about how you would wake up a teenager. Try that, okay? Be as obvious as possible so that they know you're coming. You never just want to reach in and touch them if they're not aware, because again, even the sweetest animal, if they are startled out of sleep, may feel the need to defend themselves. And we never want that situation. It's not fun for anybody. Heart disease is a blanket term that we use for any condition interfering with normal heart function. So there's lots of different ones that just kind of fall under this umbrella. You do want to talk to your vet to see if there are any congenital conditions that need to be monitored. 95% of heart disease in dogs is acquired, so degeneration over time, but not congenital. But there are some breeds that are more prone to issues than others. So signs to look for: a dry cough followed by some physical activity or during the night, so in dogs, fainting which can look like a seizure in dogs, vomiting in cats, for both shortness of breath or labored breathing, restlessness while sleeping. So if they're getting up and moving around a lot, rapid weight loss over just a few weeks, or if they get that pot belly. Okay, so if they get that big, puffed up belly, that might be fluid buildup in their body that causes that. If they are getting tired very, very early on in the day, or even just early on in exercise over what is normal for them, that might be a sign as well. So again, we definitely want to consult with our veterinarian. We might want to talk to them about changes to their physical activity routine and focusing a lot more on the mental exercise aspect of wellness. There are medications and supplements that can be used to help with heart disease. There are also specific diets that might be recommended, and also making sure that there are areas where they can go in the house just to relax, just to get away and have that time. So, for example, we have crates for the dogs that they can just go to anytime they feel stressed out. My cat's favorite place is underneath a chair, and that's just hers. We never reach in and bother her when she's under there. If we need her to come out, we bribe her with food. But, that's her decompression place, and the crate is our dog's decompression place. So making sure that they have a quiet area of the house where they can retreat to when they need to is also going to help. So when you think of kidney disease, a lot of people think kidney shutdown, okay, that the kidneys have stopped working and that there's no urine coming out. But ironically, it's pretty much the opposite. So chronic renal failure or chronic kidney disease is where the kidneys aren't filtering properly. Okay, so they're not filtering the blood for those waste products. It has nothing to do with the production of urine necessarily. So a lot of dogs in early stages of kidney failure are producing large quantities of urine, but the toxic wastes are not being eliminated, okay? So if detected early, treatment can help manage the condition and slow the disease's progress. There is unfortunately no cure for kidney disease. It's all about management. But that being said, even animals found with more progressed states of kidney disease can still have months to live. And if it's detected in the earliest stages, they can still live for years. So looking for weight and muscle loss, typically a little bit more gradual, but decrease in appetite might be a sign. Their hair coat just gets kind of gross. It's like dull. It doesn't have that nice sheen to it anymore. It's just kind of spiky. But the biggest ones to look for are going to be increased thirst and increased urination. So if you have multiple pets in the home and you suspect that somebody is drinking a lot or somebody is peeing a lot, we recommend separating them out so you can narrow it down. So like, okay, yes, I normally put out a bowl for everybody, and Whiskers is drinking an entire bowl by herself in a day. That will help. So monitoring the litter box. Automated litter box cleaners are fabulous, but they take away all of the interesting evidence that our animals leave behind when there's something going on inside. So if you are using an automated litter box, checking it every single day, checking that waste filter every single day to check to see, is there more waste in here than normal? Definitely want to consult with your veterinarian for management options. There are different specialty diets that may be recommended. Nutrition is a big, big thing for effective treatments. So for dogs, you might have recommendations for lower protein, low phosphorus, and that typically helps reduce the amount of waste that need to be filtered in the first place so that the kidneys don't have to work as hard. specialty medications and supplements will also help. And also a home fluid therapy, which sounds intense, but it's amazing how easy it can be to give fluids to our animals just right underneath the skin. Just a little injection that we can give them. So it may sound overwhelming and something like, oh no, I can't do that. I'm not a veterinarian. I'm not a vet tech. Yeah, you can. Trust me, if I can do it, and I have, you can do it. Often confused with kidney disease, diabetes has a lot of the same signs. So diabetes is the inability to produce to produce enough insulin to balance blood sugar or glucose levels. So one of the biggest signs, again, is excessive drinking and increased urination. Weight loss, even though our pets may be eating more, they are losing weight. On the other hand, they may not be eating as much. In dogs, you might notice some cloudy eyes. It may kind of look like cataracts, but it's actually a sign that something's deeper going on. And increased or recurring and chronic infections. So urinary infections is going to be a big one, and also skin infections. So definitely want to consult with our veterinarian. We might need to do a specialized diet, since obesity is a huge risk factor for the development of diabetes. We definitely want to make sure that we are keeping our pets at a healthy weight. So making sure that they are getting enough of that daily exercise. Understanding also that certain breeds of dogs are more predisposed, and female dogs are more likely than male dogs to get diabetes. So, spaying female dogs is going to help with that. Reducing the hormone levels will help with that. And then helping to maintain that proper insulin and feeding schedule. And if you are giving insulin to your animals, you want to make these sessions as fun as possible. So I recommend pairing that with a highly desired thing. Maybe it's a particular toy, maybe it's a favorite brush that they love, something like that. Talk to your vet about maybe pairing it with a special treat that they enjoy, something, very small amount that's not going to affect their blood sugar levels, but will help them tolerate insulin injections. A lot of animals are just perfectly fine with it and it's good. Some might struggle with it a little bit and they need that little extra incentive. For dogs, it's recommended that they get a very high fiber diet. Cats, it's recommended a high protein and low carb diet. They can live very long, healthy lives with proper management, and definitely make sure that you're consulting with your veterinarian, because anytime you have a change in weight, especially if you are providing insulin, you want to check in with your veterinarian to see what's going on there, to see if they need a change in dosage. So for arthritis and joint, there are some risk factors to keep in mind. Large and giant breed dogs, shepherds, retrievers, and mastiffs, so on, those are more at risk. Obese animals are also at higher risk because the joints are working harder throughout their entire lives when they are obese. Senior and middle-aged animals, more susceptible to arthritis and joint pains. Also, those animals that have done a lot of athletic activities like agility, diving, fly ball, things like that. If they've had previous injuries in the past, that can be a risk factor for arthritis later on. Prior diagnosis of hip or elbow dysplasia can then lead to joint problems in those areas. Infections like Lyme disease can lead to joint issues later in life. Poor nutrition and even their genetics can also be risk factors. So something to talk to your veterinarian about to understand, okay, this might be something more than just a reluctance to come upstairs in the evening. So if they are stiff, if they're lame, if they're carrying one foot, limping, or even if they're just struggling to get up or to their normal areas, those can be signs of arthritis and joint problems. Reluctance to do things that they normally enjoy doing. If they start gaining weight, so especially if you work outside the home and your dog typically or your cat typically does a lot of entertaining themselves, you may not notice if those activities stop while you're gone. So paying attention to if they are gaining weight because they're not being as active during the day as normal. If they are irritable or there's exhibiting changes in their behavior. Normally they jump right up on the couch with you and now they're like, nah, I'm good. I'm going to lay down here. Maybe they wince when you touch them. They might have issues getting into position to eliminate, or they might be having accidents because it's taking longer for them to get to their potty spots. And by the time they can get up and moving, it's too late and they're having that accident. Loss of muscle mass over the limbs and the spine. So if those bones are more prominent, that's going to be a big indicator. Again, say it for everybody, consult with your veterinarian and consider modifying the environment as best as possible to take the stress off joints. I would say even for like our smaller dogs like these, modifying the environment way before they get to this point, because the more stress we put on their joints in their younger lives is going to have more wear and tear and show up in their older phases of life. Okay. So, yes, the dog can jump up onto the couch, but how much is that affecting the joints? How much is that putting weight on their spine when they do that? So especially for some of our tinier pets, having those modifications will help them out, even starting that early on. It'll help them later in life. Understanding how weight affects joints is key. So again, obesity is a major, major issue for our pets, and helping them with low impact exercise. There are lots of different things that you can do. Again, just spreading their kibble portion out so that they're not eating in one place, but they're moving around to get to that kibble can really, really help. Supplements and pain management, something you want to talk about with your veterinarian. They can absolutely help with those initial aches and pains. It's not going to be always a long-term solution, but it can definitely help manage day to day. We do also want to pay attention to our rabbits and cats because arthritis and joint problems may make it harder for them to groom themselves. And if their backsides are soiled, that can lead to impaction. It can lead to all sorts of issues with their digestive system. They may need help cleaning up those areas. And again, weight management is going to be key there. So if your pet is too rotund to reach back there, that's going to be a major problem and cause difficulties in other situations. So cognitive dysfunction, it's what it is what it is. It's mental, the brain is deteriorating in certain ways. So pets might be confused or disoriented. Maybe they get trapped in a corner and they can't figure out how to get out, or they go in someplace and they can't figure out how to back out. They may not respond to familiar cues. So they might have forgotten different commands or behaviors that they've learned in the past, or it may take them longer to learn new things. Doesn't mean we shouldn't try, just means we may have to work with them a little bit longer for them to get on a new task. They might have a lot more accidents. So forgetting where their potty spot is, forgetting how to cue to go outside when they need it, can be indicators of cognitive dysfunction. You might see changes to their sleeping pattern. They might be up a lot more during the night and sleeping more during the day because they've kind of switched that rhythm. You might see reduced levels of activity, or they are pacing, staring into space. They don't seem to have purposeful activity, if that makes sense. You might also see changes in their relationships and their interactions. Maybe they're just not engaging with family members as much, or maybe they're treating family members that are known to them like they're strangers, even other pets. Maybe they're treating other pets like they've never spent time with them before. You might have howling or crying more than usual, especially at night, especially when it's dark out and their routine is now all confused. They are confused about what they are supposed to do. You might see a decrease in appetite. They might forget where their food is. On the other hand, they may have forgotten that they already ate and want to eat more often. So there are so many things going on there, and it can seem very, very overwhelming, but there are some steps that we can take. 100% consult with your veterinarian. There are supplements that can help with brain function, trying to keep their environment the same as others, and giving them clues for navigation. So, for example, lighting up areas that they would use. So if they are having issues finding places at night, there are night lights right there to help them, like, oh, I'm going to be drawn to the spot, and look, my food's here. Awesome. Or, oh, this is my litter box. Good, I needed to use it. So there are all sorts of different tips and tricks that you can help with your cat. Definitely talk to your vet about recommendations for that. The big C, cancer. Almost half of all dogs over the age of 10 will develop cancer, while cats it's more common for them to have lymphomas. So typically, you want to make sure that you're going to your vet, because they're going to diagnose it based on x-rays, blood tests, as well as physical appearance of tumors and other physical signs. So abdominal swelling, bleeding from the mouth, nose, or other areas, difficulty breathing or eating, those lumps, bumps, or even discolored skin, persistent diarrhea or vomiting, changes in weight, unexplained swelling, lameness, wounds that aren't healing. Don't assume that you can spot what is cancer and what isn't. Okay, don't assume like, oh, that's a fatty tumor, nothing to worry about because so-and-so had a fatty tumor before and it looked just like that. Just by looking at it, you can't tell if it's cancerous or not. That's why there's so much money involved in cancer treatment sometime for all animals, humans included. So they definitely do need to get that tested. There are lots of different treatment options, including surgery, radiation therapy, chemotherapy, immunotherapy, and more. So it depends on what you have, in your life, what you can provide. We've had to make that difficult decision. I couldn't afford to pay for the cancer treatment for my dog. So we did the surgery option, which was not a fix, but it did prolong her life and it kept her at a good quality of life during the remainder of her lifetime. And then it was time to say goodbye. So that's going to be a very personal decision with you, your family, and your veterinarian. Okay. It does not make you a bad person if you cannot afford a medical treatment. Okay. But just know that there are funds out there to help with medical issues. We have a list of them at the shelter. There are tons of them. Brown Dog Fund is one. There's a bunch of ones that you can apply to and get additional funds to help with not just cancer treatments, but also other medical conditions for your pet. If you are unable to afford that on your own, that may be an option instead. Okay, but just know that it does not mean that you're a bad person if you have to weigh those pros and cons. I completely understand. And sometimes it is time to say goodbye. Okay, this is the worst part about having a pet. It is the worst part about loving anybody. human, pet, whatever, is at some point we have to say goodbye. And it can be a very, very hard decision, but it's up to us to help our pets through their most difficult times. Okay. You can talk to your veterinarian about gauging that quality of life and what to be on the lookout for. There are some scales available that will have you rate your pet on pain, hunger, hydration, happiness, mobility, and good days versus bad days. Okay, so using a score of 0 to 10, 10 is ideal, like that's the perfect score. 70 is the perfect score. A score of 35 or above is considered good quality of life. Okay, so a 5 out of 10 for all of them is still considered good quality of life. However, these scales are just tools to help you, because you are going to know your pet better than anyone else. You are going to know, are they having good quality of life at this point? You know, if your pet is no longer interested in the things that it used to love, hanging out with you, food, going for walks, playing, you are going to know what their favorite things are and what that quality of life looks like. And unfortunately, sometimes the hard decision is the most humane one. You know, putting an end to their suffering is sometimes the nicest thing that we can do for our pets, as much as it breaks our hearts. And I'm going to get a little teary-eyed here because I've been through that situation a few times, and it's never easy, but sometimes it's the nicest thing we can do. It's the best way that we can show our love for our pets. And please, please consider alternatives to surrendering a geriatric or ill animal, because they do not do well in stressful environments like a shelter. Sometimes it is more humane to say goodbye now rather than sending them to a stressful place where they're going to be on their own with strangers. A lot of times shelters are not able to provide round-the-clock care, so they're going to be lonely. They're going to be scared. They're going to be super stressed out. The best shelter environment is still going to be way more stressful than in a home. Okay. So talk to your veterinarian about end of life options. We've talked about quality of life. Now, what are the options? Where can I go? You might want to look into after hours options near you as well, because if your animal takes a turn for the worse in the middle of the night, we don't want to make them suffer until our vet opens in the morning. Trust me, I did this by accident because I didn't know. I didn't know that you could take your pet to an emergency vet to end their suffering. I didn't know that. And so I made my pet suffer unnecessarily throughout a very long night for everyone, and said goodbye the next morning at the vet. Her suffering could have been ended much sooner had I just taken her to an emergency clinic instead. If you are unable to travel or you do not feel comfortable making your pet travel, there are some local services that will come to your house. And just think about, what do you want their last memory to be? Do you want it to be somewhere scary with strangers? Or do you want it to be with you, someone they love? Again, sometimes the hardest decision for us is the best decision we can make for them. And I don't want to end on a sad note, so we're going to talk real quick about making time with our senior pets count. All right. Creating memories is going to last us our whole life, and creating memories is going to make up the bulk of their happy life. Okay. So document what you can, do photo shoots, do fun things with them, make sure that you're getting photos of all of those happy times. You can also have pet paintings. So one of the things that we recommend is getting some big pieces of paper. I recommend doing this outside because it can get a little messy. Put blobs of paint on the paper, put another piece of paper on top of it, and then have your pet walk across it or sit and wag their tail, and bam, you have a one-of-a-kind piece of art that your pet created for you. And, they can't necessarily see the colors you pick, so they're not going to be too choosy. So you can pick your favorite colors and have them use that. There are also lots of paw print ornaments that you can create. Salt dough, super easy. Just press it in and then you bake it, and you've got an ornament that you can keep to help you with remember the good times. Also, you know, a lot of people who do adopt senior pets do so with the idea of bucket list in mind, you know, making sure that the senior pet is going to have the best last couple months or years of its life. So fun trips, you know, bringing new smells home for them to enjoy. For example, I work at an animal shelter, so sometimes I will bring home a rabbit towel for my dogs to just sniff the heck out of, and it's just super fun. But there are also some things that you can get even if you don't work at an animal shelter. Try out new or favorite treats. Try food recipes. You know, there are lots of things that you can make as a family together to try out with your pets and just give them a little extra something with mealtime. And you definitely want to make sure that you're paying attention to their body language, because you want these bucket list items to be fun for everybody. Okay. All right. Thank you so much for sticking with me, everyone. That is all I have. I will take questions here at just a second, but first I do want to plug, we have some upcoming webinars. So in a few weeks, we have Helping Homeless Pets. So what do you do if you find a stray animal, or how do we prevent animals from getting lost in the first place? And then middle of June, we're going to talk about enrichment options. So for all of our senior pet people, highly recommend the DIY enrichment, because that's that mental engagement that I was talking about. Okay. And we can do it super cheap, just with stuff that we have around the household, and make food puzzles or food games for our animals to enjoy. Even if we can't be right there with them, these are nice low impact exercises that they can do to help keep them happy and healthy. And don't forget, we are here to help. So if at any point you guys have questions, feel free to reach out to us. My direct email is humane.education@dupageco.org, or you can call the shelter 630-407-2800. Our goal is for all of the pets in DuPage County to be in happy, healthy homes. And there's no such thing as a dumb question, okay? We are here as a resource for our residents. Use us. Give us a call. If we don't have an answer, we are more than happy to refer you on to someone who will. Okay, wonderful. And